Hello. Let's talk about federal regulations, government organizations, agencies, and national organizations. So, the birth of the laboratory certification, or the ASCP, and the Board of Registry was back in 1928. The American Society for Clinical Pathology, or ASCP, established the Board of Registry, or BOR. We like, an acronyms and initials here, to standardize and certify the competence of laboratory professionals. The purpose was to ensure that individuals working in the clinical lab meet uniform standards of education and training. Credential were awarded, so those who passed the BOR's examination were given the professional title of medical technologist, so MT-ASCP. This became the gold standard in clinical laboratory science certification for decades. The formation of a professional voice happened in 1933. So the American Society of Clinical Laboratory Technicians, or ASCLT, was founded as a professional home for laboratory practitioners. Their mission was to advocate for the interest, education, and professional development of lab personnel. The modern identity is the ASCLT kind of has evolved into American Society for Clinical Laboratory Science, or ASCLS. And they continue to be a leader in promoting the excellence in laboratory medicine through education, legislation, and collaboration. The 1960s expansion. So it was an introduction of new roles. So as the lab medicine world advanced, the 1960s saw the introduction of new personnel categories to help support the expanding diagnostic services. A new role was introduced called the medical laboratory technician, or an MLT. And this required a 2-year associate's degree, and they were trained to assist in routine testing and support the work of the medical technologist. So then became the emergence of the specialist certifications. And to meet the increasing complexity of the laboratory testing, specialty credentials were created in core scientific disciplines. So the specialties, we have chemistry, micro, hematology, and blood bank. And then we have additional specialized roles within the lab as well, so they can pursue additional certification in the little niche fields such as cytotechnology, histology, molecular pathology, or molecular biology, laboratory safety, phlebotomy, pathology assistant, and diplomat and laboratory management. These roles contribute to a highly collaborative and multidisciplinary lab environment. History of the profession, so additional individual professional certification and licensure. So some states have a separate license that you would need to get if you wanted to work in that state. Iowa and Illinois, are not one of those. But I do have the ones listed there. So if you decided to move to California or somewhere, they do have additional requirements that you would need to look into for their licensure for that state. And they do vary by state. Some of them are a little more stringent than others. So the modern naming convention. So in 2009, there was a significant update in the professional terminology, and it was adopted to reflect the evolving responsibilities in education of laboratory personnel. So we used to be called medical technologists, or MTs, and now we are called medical laboratory scientists, or MLS. The credentialing acronyms, so professionals now earn standardized credentials through the ASCP. So we have MLS with the ASCP behind your name once you get certified, and same with the MLT. They also have MLT and ASCP as well. These designations are widely recognized throughout the nation in healthcare settings and by credentialing agencies. So continuing education requirements to maintain your certification. So certified professionals are now required to complete continuing education regularly to keep their credentials current. So this basically helps to ensure that we have an ongoing competence. Things change, right? So we need to be updated on that. Knowledge of current best practices, and then adaptation to the new technologies and testing methodologies as well. So then 2012, they introduced the DCLS, and that is the Doctorate in Clinical Laboratory Science. That actually is a post-baccalaureate and terminal advanced practice degree, meaning it is beyond the entry-level generalist of an MLS. It represents the highest level of clinical education in clinical laboratory science. So the scope and responsibilities of a DCLS, the National Accrediting Agency for Clinical Lab Scientists, or NACLS, defines the role of the DCLS professional across 5 major areas. So patient care management, education, research application, healthcare policy development, and healthcare services delivery and access. CLIA. Hopefully you guys have heard of CLIA before, and if not, they are the Clinical Laboratory Improvement Amendments of 1988. These help to ensure quality in the laboratory testing areas. So CLIA was established to ensure accuracy, reliability, and timeliness of patient test results. One of CLIA's primary goals is to ensure high quality of lab results across all testing environments. CLIA does require personnel requirements, and this is of all labs that perform human testing. We have to have a CLIA certificate, and we'll get into those in a little bit. So CLIA sets specific regulations based on the complexity of the laboratory test being performed. So waived testing, there's really not much personnel requirements beyond making sure they get the appropriate training and have a high school diploma. Provider performed microscopy, or PPM. They have minimal, kind of like wave testing, but it's going to be performed by like clinicians and physicians and stuff like that. Moderate complexity, it is going to require defined education, training, and competency. And then high complexity requires higher level credentials such as MLS, experience, and documentation of proficiency as well. So your key personnel standards for moderate and high complexity testing. CLIA outlines criteria for various roles in labs performing moderate or high complexity testing. So the testing personnel must meet educational training standards for that complexity level. So it just kind of depends, if you're doing high complexity, generally you have to have the appropriate training and experience and certain coursework such as an MLS. For a technical consultant or a supervisor, generally they would have to have a bachelor's to be able to do that. A lab director is generally a physician who holds the doctorate with lab training and a certification, depending on, for moderate and high complexity at least, that is the case. Clinical consultants assist with test selection and interpretation, and they also have a higher level education. And then there are some CLIA regulations for waived and PPM on there as well. I know the PowerPoint says there are no CLIA regulations. There are some, so ignore that on there. The CLIA defined test categories. So CLIA regulations classify laboratory testing into 3 levels of complexity. So we have wave test, which are considered simple procedures with low risk of error or harm. Moderate complex testing, which requires some degree of preparation, interpretation, and skill. And then we have our highly complex testing, and that requires significant interpretation, technical skill, and decision making. So criteria for classification of that test complexity, they are categorized based off of 5 specific factors. The first one is a risk of harm to the patient. So the higher the risk, the higher the complexity. Risk of erroneous results, so potential for incorrect results is, more regulation and higher, levels it'll go. Testing method used, so if it's manual or advanced instrumentation, again, that's going to be a higher complexity. Degree of independent judgment required, so again, they're going to have more professional interpretation, which once again leads to a higher classification. Home use availability, if it's designed for patient self-testing, that's likely going to be waived. That usually means they don't need years of training or experience or anything like that to be able to run it, and the risk if they get the result incorrect is pretty low. So examples for waived testing would be like your glucometer or your glucose meter that patients can have at home or that they run on the floors at the hospital, pregnancy testing, and dipstick urinalysis. Moderately complex would be an automated CBC or a BMP in chemistry. Highly complex is going to go to like some of your blood bank testing, molecular testing, manual differentials in hematology, and cytogenetics as well. So the CLIA wave tests are cleared by the US FDA for home use. They can use simple methodologies. Like I mentioned earlier, it's not really going to cause any harm too much, if they get the wrong result. And as mentioned earlier, the dipstick urinalysis and blood glucose are examples of those. PPM or provider performed microscopy. They must be personally performed by the practitioner, so a physician, an NP, PA, stuff like that. It cannot be somebody who doesn't have anything lower than that, and it must be categorized as a moderately complex test. The primary instrument for performing the test is generally a microscope. So a lot of times I think back to working at a women's clinic, and they did like KOHs on wet preps for that, and that was considered a moderately complex test that they would perform on the microscope, and that was generally the physician who would do it, in the patient room. The control materials are generally not available, and the specimen handling is going to be limited. It's not going to need additional steps such as, freezing and mixing things and stuff like that. So laboratory accrediting aid organizations, why accreditation matters. Laboratory accreditation ensures that facilities meet or exceed standards for quality control, patient safety, competency and training, record keeping and reporting, facility compliance with CLIA, and other regulations. So primary accrediting bodies, we have COLA, which is the Commission on Office Laboratory Accreditation, and this mainly focuses on physician office laboratories. CLIA has a deemed authority over them and provides education-based accreditation. CAP, which is the College of American Pathologists, they are internationally recognized. They use a team of practicing laboratory professionals as inspectors. So you could be a CAP inspector, someday to go to a different lab, which is always kind of fun to go see. So if you get the opportunity, I would recommend to do it. And then they also focus on laboratory excellence and innovation. The Joint Commission, they accredited hospital labs since 1979 and have started accrediting freestanding labs in 1995. They they integrate, lab standards into the broader hospital accreditation. So they kind of tie it in maybe a little bit more than CAP does. Beyond the primary three of COLA, CAP, and Joint Commission, there are several specialty organizations that can provide accreditation to specific or certain laboratory types and practices. So the specialized first one would be the AABB, or the American Association of Blood Banks, and they accredit, you got it, blood banks and transfusion services. They focus on quality and safety in the blood collection and the use. Then we have American Society for Histocompatibility and Immunogenetics. They accredit labs involved in transplant compatibility testing. They help to ensure excellence in histocompatibility and immunogenetics work. And then we have American Osteopathic Association. This accredits facilities related to osteopathic medical practice, and it includes some laboratory and clinical services. So in addition to the CLIA 88 federal mandate, laboratories are subject to multiple layers of external regulation to ensure safety, quality, and compliance. So federal oversight is, once again, CLIA. They are the core regulatory framework for lab testing accuracy and personnel requirements. FDA will regulate lab devices, test, and personnel certification licensure. CDC will monitor lab safety protocols and mandate certain test result reporting. For environmental and chemical regulations, for hazardous waste disposal, that is governed by the EPA and state laws. Use of hazardous chemicals is regulated by OSHA. Biohazard handling and standard precautions is required under OSHA and CDC guidance. And then we have our state level regulations, I cannot talk. Medicaid agencies, so they impose specific compliance measures for reimbursement. State public health and environmental laws can govern operations and waste management. Licensure laws, there are many states that we mentioned that require individual and facility license for lab operation as well. And then we go down even to the local level regulations. So there are building codes that ensure that the lab infrastructure meets the safety and accessibility standards, and also the fire prevention codes to help regulate chemical storage and emergency planning.